on. Good evening, everyone, and welcome to tonight's show entitled Men's Health: How to Live Your Best Life. I am your host, Michelle Campbell, and I am so excited about this panel discussion tonight. Many men have asked me to join and have a group of men come together to speak on men's health. And we're in November now. I think I got asked in January to do this. So I'm so excited to finally have a chance to have this show. Tonight, I have five of the best doctors on the show who can answer your questions. Um, in the live chat, be sure to put your questions in and we will read them at the end of the show. Okay, so this program is designed to provide information. It is not a program to make a diagnosis or give any kind of medical recommendation. So we have to keep that in mind during the show. All right. Also, we have five wonderful doctors, distinguished and intelligent and debonair, as you can see. Some of them are dressed in their scrubs, some of them are on call. We got them in here live and in person. They might be in and out, so just keep that in mind too, because like I said, some of them are on call, but this is going to be a great show. I'm going to go and speak about each and every one of them so you can get a feel for who we have on the show tonight. And the way the show will flow is each doctor will have 8 minutes to speak on their recommendations or advice or information they'd like to share with respect to men's health. And then after that, we'll have the Q&A, and then we will wrap up for the evening. So without further ado, I am about to introduce our first doctor for tonight. That is Walter Scott Metcalf, MD, is an American physician and business owner, best known for his appearances on Bravo TV's Married to Medicine series, guest on HLN Headline News, providing expert opinion on world health issues, guest speaker and lecturer on radio, and highly featured on numerous podcasts. His involvement in published research as an undergraduate at Michigan State University, go green, has contributed to current research in prostate cancer treatment. Dr. Metcalf is a graduate of Michigan State University with a BA in biological science. He also has his medical doctorate from Wayne State University and is a board certified family physician. His growing popularity has Dr. Metcalf being sought out for professional expert opinion on world health issues, lifestyle medicine lectures, physical health, and preventative medicine. Welcome, Scott. I'm going to call him Dr. Scott for tonight to the show.
Thank you for having me, Miss Michelle Campbell. I appreciate being here.
Thank you. Now we have the twin doctors, and they are, as you can see, twins. They look just alike. They got their names underneath so you can figure out which one is which. We have Dr. Jamel Abdur Rahman and Dr. Idris Rahman, Abdur Rahman, are both certified obstetrician gynecologists from the Chicagoland area, my second home. Dr. J is also the chairman of obstetrics and gynecology at Waukegan's Vista East Medical Center, using guest television appearances in the platforms of written and video blog. Dr. J and Dr. I present on passion and entertaining look into the worlds of medicine and travel. Dr. J and Dr. I developed a passion for travel and appreciation for the ability of travel to entertain, educate, and possibly even to heal after they participated on season 22 of CBS's The Amazing Race. It was as contestants on The Amazing Race that the world's first introduction of the lovable, intelligent, if not slightly dysfunctional twin doctors as they raced unsuccessfully around the world in an attempt to win $1 million. Not long after completing The Amazing Race, Dr. J and Dr. I started a medical blog that they call appropriately Enough Twin Doctors TV. Twin Doctors TV features a combination of written and video blog content that covers contemporary topics in medicine, presenting these topics in a manner that is sometimes entertaining and always relatable. Following the launch of the Twin Doctors TV, Dr. J and Dr. I were featured as medical guest experts on CBS's The Doctors television program. While on The Doctors, Dr. J and Dr. I were asked to discuss the unusual case of a Missouri woman who delivered her twin babies 39 days apart. In 2015,
Wow.
not long after their appearance on The Doctors, the twins were featured in a new Ancestry.com ad campaign. The Ancestry ad featuring Dr. J and Dr. I can still be seen both nationally and internationally. Following their appearance in this Ancestry.com ad campaign, Dr. J and Dr. I next launched their newest project, their first book, Everything You Could Ever Wanted to Know About Pregnancy. When it comes to the matters of health, wellness, and travel, Doctors Jamel and Idris Abdur Rahman are entertaining and informative resources. These authentically relatable twin doctors are just as comfortable in front of the camera as they are behind a pen, and they are eager to share their knowledge, expertise, and passion. They can regularly be seen on the blackdoctors.org, Windy City Live, and on Fox 32 Chicago with Sylvia Perez. Thank you and welcome both Jamel and
Thank you.
Idris
Thank
to
you
the
for
Thank you.
having
show. Doctor, I will call you I and J for the rest of the
That'll
show.
work.
me. Thank you.
Thanks for having us.
Thank you. Next, we have Dr. Courtney Shelton, who was born and raised in Detroit, Michigan, my hometown. Following in the footsteps of his mother, who was a registered nurse, and a father who was a veterinarian, Dr. Shelton soon realized he wanted to continue his family's legacy in healthcare and entrepreneurship. Dr. Shelton graduated from Michigan State University, go green again, with his medical doctorate
Green
and
or white?
completed residency at Hurley Medical Center. Dr. Shelton is a board certified internist currently practicing in Atlanta at Shelton Hospitalist Group and is affiliated with Atlanta Medical Center WellStar. Dr. Shelton's passion and commitment not only lies in the primary care, but also in the research. As principal investigator of several clinical research trials, he sits at the forefront of new groundbreaking medication, therapy, and treatments that he uses to provide more efficient health care for his patients. Dr. Shelton is specially trained to help prevent, detect, and treat diseases in adults and to manage chronic diseases such as diabetes, high blood pressure, high cholesterol, asthma, hypothyroidism, arthritis, depression, and Dr. Shelton also treats acute complaints, including infections, abdominal issues, rashes, joint pain, and headaches. Welcome, Dr. Courtney, to the show.
Thank you, Michelle, for having me.
And last but not least, you all have seen this doctor before on the show, but I will reintroduce him again. This is Dr. Geoffrey Mount Verner. He is a decisions expert and board certified ER physician. He was on the front lines of Hurricane Katrina while deployed with the Maryland National Guard as a physician in 2005. He served as the chief and chair of a large urban ER during the H1N1 pandemic in 2009. He was appointed by the mayor of Washington, D.C. as the Emergency Services Medical Director and Assistant Chief to lead the emergency responses of the Ebola crisis in 2014. He works on the front lines in the ER of the COVID 19 pandemic of 2020, which, by the way, is still here. America's split second decision expert, Geoffrey Mount Verner, is a best selling author, international speaker, ER physician, and executive. Dr. Joffrey, Harvard educated, has 25 years of making split second decisions that were truly life and death. He also holds degrees and or medical training from schools that include Hampton, Harvard, Wayne State University, George Washington University, University of Maryland, Shock Trauma, and Johns Hopkins Universities. Dr. Joffrey lives in Maryland with his wife, 17-year-old daughter, and 14-year-old son. Welcome again back to the show, Dr. Joff. Glad
Thank
to
you.
have you
Thank you for
here.
having me. Thank you for having me. And hello, fellow colleagues. What's going on with you?
How are
Hello,
you?
how you doing, sir?
Well, how are you?
As you can see, we have a powerhouse panel with us tonight. So I hope within this hour, the men that are listening to this show, either live or or recorded after the fact, get something out of this because the doctors are in. So let's get started right away. Let me share some quick stats, sobering stats, that is, about Black men. According to the Centers of Disease Control and National Cancer Institute, 44% of Black men are considered overweight. 37.5 are obese. Black men suffer more preventable oral diseases that are treatable. Black men have a higher incidence of diabetes and prostate cancer. Black men have a high suicide rate. It's the third leading cause of death in men ages 15 to 24. And 10 leading causes of death, according to the CDC. They are as follow. Number one, heart disease. Number two, cancer. Three, unintentional injuries. Four, homicides. Five, stroke. Six, diabetes. Seven, chronic lower respiratory diseases. Eight, kidney disease. Nine, septicemia. And 10, hypertension. So if you noticed in that list, there were only two that were non medical related. So I'm going to open the floor to Dr. Scott, who can shed some light on Black men's health and ways that they can improve it. Welcome, Dr. Scott.
Thanks again. I'm honored to be here, and I appreciate being a part of this panel with these distinguished gentlemen for sure, and that I already know and actually trained with, and Dr. Shelton, undergrad and in residency a little bit. But yeah, Black male health. If we're talking about men's health in general or Black men's health, we need to talk about the things that are plaguing our community. And I think we can break that down kind of age appropriately, like you said. Our adolescents and our youth, we want to just make sure we screen them for genetic conditions, any illnesses. We want scoliosis, everything that goes along with their health and growth and development. And at all ages, I think one thing we need to start doing as physicians is screen our Black males for mental health, because mental health is something that we've been in medicine in general, we have been lacking. We know the stigma associated with mental health and mental disease. We don't want to touch it. If it affects someone in our family, we try to sweep it under the rug. And even professional families have been known to do that. And we kind of just have avoided one of the most important things in you know, in our existence, and that's our mental health. And because people don't tend to treat mental health as a disease. I'm family medicine, so of course I practice preventive medicine, and so it's total mind, total body, but I think personally have we I think in our training we just did not tackle mental health, and it's become very important. And like you said, we have been in, and you mentioned the top 10 causes of death per year, but something else took the role of the number 3 position last year, and what was that? That was
Oh,
COVID-19 deaths in
mhm.
the U.S. So that's have been part of this pandemic has affected all of us, and it has affected mental health. Our teen rate of suicide has increased. Our adult male suicide rate over 55 has increased. Our military veterans, their rate of suicide is higher than the norm. So mental health is very important. So as physicians, we not only do we have to do our yearly screening for a patient when they come in, we have to talk about mental health to them. We need to talk about depression, their mood swings, how their relationships are with their family, how their relationships are with their children, how their relationships are with their job. It's kind of we're physicians, and we're actually getting to the realm of social working, because if you don't have a healthy mind, your body is truly going to fall afterwards, and that's just a natural fact. So we talk about diet and exercise because we know that exercise and increased activity that boosts our physical health as well as our mental health, releasing endorphins. So if you feel good about yourself, you're going to actually do better. Yearly, we need to screen our males for alcohol use. They're simple questions that we use. They depend on the amount of drinks that they may drink in one setting, how many times they may drink during a week. And we can use that to assess whether or not they are suffering from alcoholism. Our youth, let's go back to our 16 to 25-year-olds. Car accidents, motor vehicle accidents being one of the major causes of death. So we have to talk to them about driver safety. We need to talk to them about, of course, sexual activity and preventative medicine. We want to talk about preventing STDs in our males. We want to screen them for STDs when they're sexually active in that age group. And there are different treatments, or they're different. I mean, I know the twin docs can tell us more about it, but we have the HPV vaccination that is available for our young men in order to prevent, human papillomavirus is HPV, and that will be the virus that causes genital warts that can cause cervical cancer in women. So this has shown to be very effective in preventing cervical cancer in women. It's also preventative of getting your genital warts in males, which can be, once again, they're sexually transmitted and can lead to cervical cancer in women. We need to screen our youth. One thing our black males are not leading in is the use of illicit drugs in adolescence.
Mhm.
But we still have a high incidence, and we know that our media, unfortunately, is influencing our males to try drugs a lot earlier than what any other ethnicity, because they've been influenced negatively, unfortunately, by a lot of their influences in the world of television and entertainment. And so we need to screen more for illegal substance abuse. Questions that weren't asked when I was a kid. They may have asked if you tried marijuana, but now they have, do you try illicits? Have you tried opiates? Opioid crisis is enormous right now. And the opioid crisis is taking the lives of our youth right now as well as our elderly. So, and not to mention the epidemic of them becoming addicted to opioids, and the crisis that can lead after that, with
Yeah.
everything that can go with the social stigma of being associated, and just being addicted. And we have to explore the addiction and treatment. And fortunately, that the opioid crisis didn't hit the African American community the hardest. America is taking advantage. America is taking a look at it. So once the opioid crisis, started affecting other communities, as crack epidemic affected our community, now as opposed to being that, that crackhead, that low life, that that person who's not any good, untrusting. Now they realize that this person is someone that has unfortunately, become addicted to a substance that their brain chemically depends on. And so those are some of the main things I think that we need to start concentrating more on as physicians, and that I have implemented more in my practice over the years. Of course, the preventative medicine, age appropriate medicine. Like I said, we screen 18 to 25-year-olds different than we screen 25 to 35-year-olds. And then once we get into the age group that some of us are approaching or have met right now, our 50-year-old, we have to, or 45, we need to start screening for prostate cancer. We need to do our every 1 to 2 year eye exams to screen for glaucoma, which is high in the African American community. And a lot of, our problem is always late detection. Whenever you detect something late, then what's the problem? That's when we have, we have a less chance of having a great cure, a less chance of recovering from illnesses, or getting an illness or disease detected at an advanced stage. And that would be with our colon cancer screening, age 40, 40, they say 45 to 75.
Need to get serious about this. I mean, there are people checking out of here, and people like my age, people that I went to school with. And I don't feel like I'm that old. I'm older, but I don't feel that old. But we are checking out of here, like nobody's business. So I could continue on, but we got 4 other doctors. I want to continue, but thank you, Dr. Scott, for that insight. The next doctor, we're going to move to the twin doctors, Dr. I and Dr. J. So these doctors, they travel all over the world. And so I know in your travels, in the midst of having a good time, you are probably seeing a lot of different cultures and the different way of how medicine is handled and the level of treatments that are provided in those environments. And just give me your perspective on, you might have something in mind that you want to talk about, but I thought because you've been around the world, so to speak, I've been following y'all. Y'all just came back from the Maldives, and my bucket list. I want to get there.
It's amazing. Well, I'll tell you, I think we all kind of prepared to talk about one topic in particular that we felt affected men's health. And I did do that. But in listening to Dr. Scott talk, it really got me to thinking, because an ounce of prevention is obviously worth a pound of cure. Preventing something rather than treating it when you have it, ideal. And, we talk about screening, and we talk about early exams, and we talk about lifestyle modifications and all of the things that we think will prevent disease, and they do. But one thing, and this is kind of segueing to what you mentioned about travel. I was in Ireland a few years ago, and I learned when I was in Ireland that the Irish had the highest suicide rate in Europe. And I didn't know why. And I came across a tattoo artist who had a tattoo parlor where he basically just covered up people's self-harm wounds. So people who had tried to commit suicide but hadn't committed suicide or hadn't been successful. And so I started doing research. Why is the suicide rate so high in Ireland? Because Ireland's beautiful, amazing people, amazing place. Why is there this high suicide rate? And I came across some interesting research that found that basically because of the potato blight, there was the famine that occurred in Ireland. There were what are called epigenetic changes to the DNA of Irish people that turned off certain genes, turned on other genes, and in the process made them more prone to depression, anxiety, and higher suicide rates. And the more I started to dig into epigenetics, because I hate to say it, as a physician, I wasn't really aware of what epigenetics was until a few years ago. The more I started to dig into it, the more I realized how that is a major issue for African Americans. The reality is that the average white male in this country will live to be about 78, 79. The average black male, about 68. Now we know the reason why, right? We know that there's more heart disease, there's more cancer, there's more prostate cancer. Black men are 2 times more likely to have prostate cancer. There's a higher risk of diabetes and stroke, and you name the disease, Black folks are more likely to have it. But the question becomes why, right? Part of it's lifestyle, part of it's diet, and we do as we were taught, and our children would do as they were taught. Part of it is the socioeconomic stresses that we deal with, but part of it also is going back to this prevention, but it's a prevention that we can't address. It's going back to the epigenetics and the trauma of not only slavery, but the strife that occurred after slavery. And there's a lot of research now that looks at how emotional trauma, physical trauma, psychological trauma literally causes what are called epigenetic changes. And so the way our DNA works is, as far as we know, most of the DNA in our chromosomes is inactive, or it does things that we don't know, right? It has some function, but we're not sure of all of these functions. But what they found with epigenetics is, like I said, psychological trauma, social trauma, physical trauma will turn certain genes off, turn other genes on, modify how certain genes work, and in doing this, make you more prone to a slew of diseases. Just like you see more depression in Irish people, it's thought that you may see more hypertension and more diabetes and more cancer in Black people because of the epigenetic changes that result from the trauma of the African-American experience. And so when we talk about prevention of disease, certainly taking these steps, diet and exercise and early screening are important, but you have to take it back to the mental health aspect as well, right? Because there is so much psychological and emotional trauma that African-Americans carry that isn't even their own per se, that has affected them genetically, and in doing so, affected their overall health. And so I think that's why mental health really becomes important, because it will allow you to not only deal with your trauma, but potentially that trauma that you carry that you're not even aware of. We carry so much from our past and from our ancestors that affects us in ways that we do not even know. And I think that's when we talk about the prevention piece, that's one part that we all tend to miss as physicians, because we don't think about preventing that which has already occurred and how that has affected.
Yeah.
And I was going to say, Dr. Metcalf kind of touched on that as well. He was talking about the mental health piece of it. Kind of what I was planning to talk about tonight primarily was a mental health piece of it, because I think that is huge. I think, like you were saying, Jamel, part of it is just epigenetics. Like we've dealt with a lot of stuff for many, many centuries in this country, but I think also, in our community and in a lot of communities, and especially with men too, we don't really discuss mental health as much as we should, right? I mean, as men, we're strong, we're this, like we carry the weight, like we can go and we can cry around the corner when nobody's looking, but we have to be strong for the face of the world, and especially in Black men, we've had to be that for centuries, right? Like, if you weren't a strong person on the plantation, you didn't survive, even if you weren't strong post-slavery days, you didn't survive because there weren't any handouts, so we have not really ever grappled with our past, nor have we grappled with mental health in our community, both as men and as African-American men in particular. And, I was reading the statistic. They said that 60% of African-Americans have reported mental health issues. So at first it's like, well, 60%, that's not that big a number. When you boil it down, we're talking about over 7 million people. Okay, that is 7 million plus people. And we can discuss the whys. We can talk about racial pressure and social pressure and, historical pressure, what's going on currently, socioeconomic status, comorbid medical conditions. There are a million and one, reasons for it. But I think the real thing we need to address is, how do we deal with that now? Like, okay, we can address all those big social changes, right? What does that mean for me right now in this moment, And I think we've got to start to tear these barriers to mental health down, There is this social stigma that men have to be strong. I've got 3 girls and 2 boys, and you have to raise boys a little bit differently, girls a little bit differently, because they're different social situations, right? But I tell my boys that and my girls too, that there's nothing wrong with crying. There's nothing wrong with being emotional. There's nothing wrong with telling people how you feel, So we've got to break that barrier down. We've got to break that stigma down, I tell people all the time, like I'm one of those open books. Like I probably am inappropriate sometimes with what I share, but I tell people, yes, are we physicians? Absolutely. But we're also human beings, right? We're human beings, and we deal with the same things in life that everybody else deals with, And I have no shame in telling folks that ever since my dad died, when we were like, what was that, 20, 13, 14, whenever my wife was pregnant with our last daughter, my wife is telling me for years, you should see a counselor, you should see a counselor, you should see a counselor. I was like, no, I'm good. No, I'm good. And finally, when my father died, I said, you know what? I think I should do that, and that was in 2014. It is now 2021, 7 years later, and I still see a counselor, because when I did that, I discovered, I was like, wow, like the depths that you go to when you go into counseling, it opens up things that you never even knew were there. And also, it's just good maintenance. It is just good maintenance, like we're talking about maintaining our heart health and our blood sugar and our cholesterol. Maintaining your mental health is important as well. So I think that is one thing that if I can impart one thing to the men, black, white, yellow, green, whoever, men, women who are watching this, we've got to value our mental health more, because like Dr. Metcalf was saying, like I tell new moms all the time, when they're stressed out, I'm like, if you're no good, you're no good for anybody else. You can't take care of your baby, you can't take care of the family, you can't do what you need to do. So you've got to make sure that you are good before you can take care of everybody else. So I just want to thank Dr. Metcalf for that, and Dr. J as well. I think that is so important. It's something that we really need to focus on more. And I think that genetic piece of it is really interesting as well. But we also need to kind of focus on what we can do in the here and now. That is seek care, tear down those stigmas, tear down those barriers, and don't be afraid of counseling, and just talking to other men as well. That's another big one. Like talking to each other, because luckily I've got like a built-in, my roommate, my brother. We go through the same things at the same time. So I've got somebody I can talk to, like, oh my God, I'm going through this, But a lot of men don't have that or don't feel comfortable with that. So that's something we need as well, just that social support.
And Dr. Idris, like you said, and with the mental health and the counseling, any type of counseling you do, it all goes back to childhood. Isn't that crazy? Everything, it's almost like Kenya Barrett says, it all goes down, all back to slavery and all those movies. Everything that we do, everything that affects us, man, it's amazing that it all goes back to childhood.
And that's why we can start these patterns early. That's why if we not only tell our children, but show our children that we value our mental health and that it's okay to have emotional issues, emotional moments, it's going to make a huge difference in the generations to come.
And it's not to hijack the conversation and make it all about mental health, but I think it's important for people to realize also that there is no separation between mental health and physical health. We tend to do that. We talk about mental health and physical health like they're two different things. It's health, because your mental health directly affects your physical health, and vice versa. Your physical health directly affects your mental health. The brain and the body are connected. They're not separate entities. They're all sharing the same real estate, the same space. And so it's important that people realize if you want to be physically healthy, you need to be emotionally healthy, So I just wanted to say that. I think making sure that we don't separate the two is important.
Do you think that not just men, but people even know that they are depressed or they have a mental issue going on? Like how is it something that you kind of, after talking maybe at a doctor's visit or something, you realize there's something going on here, or how does that come out?
So this is the thing. So, there are screening tools to see if patients have depression, because a lot of people don't realize that what they have is depression. They think it's life. Yeah, I'm sad, I'm down, I'm struggling, but they don't realize themselves that they have depression, and maybe I'm an open book, too open, but there was some time where I told my wife, like, I swear, I think I have like a little minor depression, like a little dysthymia, like I truly think that I do. But it took me a long time to realize that. It was almost like an aha moment. And I was like, oh my God. I scream for this all the time, but I think I have a little bit of depression. So most patients are not going to come to you and say like, oh, hey doc, I'm depressed, give me some meds. I need to see a therapist. Like, they're not going to. You have to kind of read between those lines. They're going to just, it's just things they tell you, like, oh my God, my relationships are in shambles. Like, I'm always yelling at my kids, and my husband and my wife hates me, and I just don't want to do anything anymore. Then you have to kind of start to put two and two together, like, you know what, I think you're depressed, And most people are kind of they're kind of resistant to that. First, like, no, I'm not depressed. I'm just whatever, because we have, again, that stigma. Like, I'm not crazy. That's what they say. I'm not crazy, But yeah, a lot of people do not realize actually what's going on, which is why it's important for physicians and healthcare professionals to screen. But it's also important for people to be aware of the signs and kind of self-report, like, hey, this is what's going on,
Michelle, a lot of times the stigma is really great. I mean, I recently had a patient in the office and basically was telling me that she's hearing voices. And so immediately, we started thinking, well, that's possibly schizophrenia, often misdiagnosed or see them out in the street homeless. But when I mentioned to her, I think it would be great if we saw a psychiatrist so we can get this evaluated and see what's going on. The first thing she said to me, I'm not crazy. And she didn't want that referral. So the stigma is so bad. It's just something that in our community is it's a big challenge, But she was in my office complaining of hearing voices and really was schizophrenic. But as soon as I offered her some type of therapeutic opportunity, she was like, I'm not crazy. So it is a challenge.
It really takes a burden off you because I think to your point, Dr. I, you were saying like we just think it's life, it's like we supposed to be struggling, we always had to, scrape and scratch and whatever, right? But until you get to that point, like you don't know until you actually can go on the other side and be like, oh, that was real messed up over there. I was really stressed out, or I had a lot on me and I didn't even realize it. But people, when it shouldn't be, life should not. I mean, we go through stuff, but it shouldn't be. And I'm just saying this because I did a mental health show a couple months ago, and had some specialists who specialized in mental health, and it's amazing that you could be standing next to the person, you could be working side by side with them, they're very functional, it seems like they carry on a regular life, but they are totally depressed and you wouldn't even know it. I had a coworker, and he would come to my office, he'd peek his head in the door and he'd say, pray for me, Michelle. And then I was like, okay, and not really thinking much of it, he did that a couple of times. And then next thing you know, I heard that he had committed suicide,
Mhm.
and I didn't know he was that bad off. I mean, because we're working, functioning, going to meetings and doing this and that, but in the background, and it hurt me because I saw that he was hurt because there were some family issues going on, but I didn't realize it was to that level. You just never really know. So, I want people to hear this show. I want them to hear the message right now because there's somebody out here that's listening that they're probably like, you know what, that's probably me. I'm stressed out. I
I think
can't
that
focus or what have you. Yeah, go ahead, Dr. Day.
I was just going to say, I think it's important for people to know what depression looks like too. Because, like Dr. I was saying earlier, we have all of these screening questionnaires that look for signs and symptoms of depression. And most people think when they're depressed, they just feel sad. They just feel down. You certainly may feel sad, you may feel down, but there are a lot of physical manifestations because, again, it's a mind-body connection. They're not two separate entities. There are a lot of physical manifestations of depression as well that people may not know to look for. When you're constantly feeling achy, that oftentimes can be a sign of depression. People just say, oh, I'm getting old. I'm this. Maybe you are. We all are. But oftentimes that can be evidence of depression. Or if you notice changes in your appetite, appetite's up, appetite's down, that can be evidence of depression. If you find that your sleep patterns have changed, be it that you're sleeping more than normal or you're sleeping less than normal, that can be signs of depression. If you find that there are changes in your sexuality or your sexual drive, feeling like you want to have more sex, feeling like you want to have less sex, that can be a sign of depression. When you're just disinterested in things that previously you were interested in, used to be a big time Bulls fan and now you could care less if the Bulls game is on. That could be a sign of depression.
That's
and
just
so I think that, again, when you can really hammer home the fact that it's a mind-body connection and mental disease can manifest itself physically and vice versa, people will then maybe start to recognize more that maybe they suffer from depression because, again, depression isn't just sitting in a dark room wanting to cry. It certainly can be that, but there can be a lot of physical manifestations as well.
Right.
I think to kind of add that a lot of times when I see patients and they may be exhibiting or having some symptoms of depression, is to really ask them how is it impacting their life, because they'll blow you off. But you go, well, how's work? They're not going to work. They're not engaging in their relationships, like you mentioned, not interacting with their children, fighting with their husband. So it's important sometimes as physicians, especially in primary care, when you're dealing with so many different things, pain and high blood pressure and all these other things, mental illness is so significant, it impacts our patients. Sometimes determining how it's impacting the quality of their life will really give you some clues that they really need treatment.
Hey, I'd like to jump in there too as well. Hey, everyone, I'm Dr. Joffrey, crisis and split second decisions expert. I just want to jump in there and just talk about, comment about the depression, and then pivot to high blood pressure. So one of the top 10 signs of high blood pressure, believe it or not, are fatigue and feeling bad. And part of that has to do with your organs not being perfused well. But there are 10 causes to high blood pressure that we all need to be aware of, because of the top 10 that Michelle started off mentioning. She mentioned things like stroke, high blood pressure, kidney disease, and diabetes, which are all tied to high blood pressure one way or the other. But these are the 10 signs that as an ER doctor, you should always think about. I mean, that you should be, from what I see in the ER, these are 10 signs that patients should not ignore. A headache. If you just have a headache and you don't normally get a headache, you should probably go and get your blood pressure checked. Blurred vision. You don't normally have it, your blood pressure could be high. I already talked about just feeling tired, feeling down. Chest pain, that could be a sign you're having a heart attack. Focal weakness, meaning that you can't move your right arm, you can't move the side of your face. That's a sign that your blood pressure could be high. Nausea, vomiting, shortness of breath, back pain because you have a major artery that's messing you up, a major artery that may have ruptured. And believe it or not, difficulty sleeping. Difficulty sleeping is absolutely key. And nosebleeds. You know, the most common cause of nosebleeds, people do not know this, is picking your nose. But outside of that, your nose bleeding could be a sign that your blood pressure is high. And the number one cause, drum roll please, of high blood pressure are no symptoms at all. Meaning that your blood pressure can be high, quite high, and you not know it for many months to years because you don't get it checked. In summary, it's so important for you to get your blood pressure checked regularly, because these days we've got a number of different medications, a number of different, for those people who are into herbs or lifestyle changes, there are a number of different ways. And the classic patient that I see is that young male, often Black, who comes in and their blood pressure is quite high and it's been high, and they're not taking their medications for many different reasons. But the most common reason is because it affects their libido. It affects whether or not they can get an erection. And if that happens, we simply change your class of blood pressure medication and just keep it moving. But let me summarize. Checking your blood pressure regularly is absolutely key. Sorry to jump on in there, but go ahead, host Michelle.
That's great. I mean, I like the interaction. It doesn't have to be so structured. I know the next up is, Dr. Courtney, but, feel free to piggyback off of each other. Dr. J, Dr. I mean, very good insight, right? Very good insight.
I just want to say one thing that Dr. Joffrey, it's funny. I'm a physician, right? Okay. I called my doctor to make an appointment, right? And they're like, "Oh, you're a new patient." I was like, "I've been here for like 25 years. What are you talking about?" Anyway, they looked back, they're like, "Oh, you haven't been here for 10 years." I was like, "Okay, wow, I guess I'm a new patient." Didn't know I did it wrong. And I was having these mild headaches. I said, it must be the coffee or the lack of coffee, the stress. Checked my blood pressure. It took me a while as a physician. I was like, I'm young. Let me put two and two together on this one. My blood pressure is like in the 160s, 170s. Okay, systolic. That's high. So my point is, I just want to piggyback on what he's saying. You got to be in tune to your body. You got to be in tune to those the headaches, the fatigue, the dizziness, all those things that normally shouldn't be happening. Please, as Black folks, need to check our blood pressure. I made some lifestyle changes, lost a little bit of weight. I'm off the medicine now. But the thing with high blood pressure is, if your blood pressure is acutely high for a day or two, not going to kill you for the most part. It's what it does over months and weeks and years. And so that's why we got to diagnose it early and manage it. Sorry, I didn't want to interrupt. Sorry, go ahead, Dr.
No, it's no interruption. Y'all just talk. Keep going.
It's a silent killer.
Well, it is a silent killer. But before I talk, I do want Dr. Shelton to go ahead and make his point. Plus, I got a patient that's on the board, so I want to listen to what you say, but I'll be right back.
Okay.
Gotcha. These messages.
Well, I've been a primary care physician in Atlanta almost 20 years, close to 20 years now. And one thing I think it was Dr. J said that was really interesting. If you think of the life expectancy of a Black male to be 69 years of age, that's scary. I'm 52. So when I did the math, I was like, man, that's right around the corner.
Right.
So that's really scary. So when I think of that, and I always share this with my patients, I say, if the average Black man lives to be 69, that means we have to have a better than average lifestyle to live beyond that. That's a fact. I gotta make changes in my life if I want to live beyond 69 years of age. And it's so critical. And that comes back to lifestyle change, exercising, being active, changing the way we eat, period. Just like Doc just mentioned, hey, my systolic was in the 170s. I exercise, I lost weight, I'm off meds. That is amazing. One of the biggest challenges I face as a primary care physician is always fighting the number one killer, which is coronary artery disease, right? So we look at the risk factors: high blood pressure, silent killer. When I do health fairs, barbershops, churches, it's amazing when we do blood pressure, most people have high blood pressure. And then the person will turn around and say, well, you know, doc, I'm already on medication. Most people who are treated for high blood pressure aren't at goal. What's the goal?
Right.
120 over 80. So you look at so many people who are undiagnosed, who are not properly treated, and a lot of it is the patient, but the doctors as well. We're not as aggressive as we should. You know, when you look at high blood pressure, what are the complications? Aneurysms, strokes, heart failure, heart attack, dialysis. So these are things, it's like walking off a cliff. You get heart failure, when you're on dialysis, your life will change, be shortened. You know, so it's critical. We look at diabetes as another risk factor, very important risk factor. I think 80% of what I do deals with diabetes and high blood pressure management every single day. That's 20 to 25 people a day. And what's amazing is the compliance. You know, it's hard to get people to buy into eating better. That's the biggest thing, is how people to make better choices. I always talk about, man, we got to get rid of the white food, decrease the white food. That's white salt, flour, white rice, white bread, white potato, white pasta. That's our staple. That's what we eat all the time. With Thanksgiving coming up, but sometimes that's the biggest challenge. You know, we also look at high cholesterol. Your cholesterol is high. Unfortunately, if you make the wrong cholesterol, your liver is endogenous versus exogenous, where we're eating Popeyes every day. You know, we look at even so those are things that we deal with every day. Even Scott mentioned alcohol. Tell my patients, some of them are drinking a 6-pack a day at work. And I always, the American Heart Association says 2 drinks a day. There's so many, as I listen to all the physicians, great physicians, there's so many aspects to men's health care that focus. I think one of the most interesting things I deal with is, I would say 60 women, maybe 65. They're used to coming to the doctor, getting pap smears, in conditions since 14 years of age, to see the doctor once a year. Men don't come. Men have great jobs, pay for their health insurance, $500-$600 a month, and at the end of the year, they may have spent $6,000 a year on their health insurance and have never seen the doctor.
Yep.
It's amazing, and I don't see them until somebody dies. Only guy next to them that works in the prostate cancer, so they get concerned. So it's really tough. I have a him on Saturday morning with a toothbrush cleaning the rims on his car, but he doesn't go to the doctor. You know, he puts more effort and interest in his car than his life. So those are things we just have to do. I'm trained in med, and in my resident 1997, even during that 2001, we never talked about diabetes type 2 as a disease of children. And now, because of our children are overweight, and as a result, we see a lot of children. I see a lot of adolescents that have diabetes type 2. So again, when we're trying to really make it, then we got to get. They have to be educated. That's why a program like this, men need to be educated. Another thing that's interesting, and that's usually the office that I see. I see them because of Viagra, and I use that discussion because I'm always like, hey man, we got to make sure you don't have diabetes. We got to make sure you don't have atherosclerosis, clogged arteries. Those arteries are clogged in your penis, they can be clogged in your heart. So often that's the way I can get to really erectile dysfunction. Really get into these, especially my new diabetics. Man, if you don't take it as diabetes, man, you're gonna have erectile dysfunction. And they need to understand that because that's in. So they need to.
Excuse me, Dr. Courtney. I can only hear every other word. Is it
Yeah.
only me?
You're fading in and out.
Yeah. So instead of why don't we? Is there anything we can do to assist so that we can hear them?
That's what I was just looking at. Maybe if we mute our microphones,
Okay. Let's try
maybe
that.
that'll help.
Good
Is
job.
that better? Can you hear me better?
Yes.
Yeah,
Okay.
don't lean back too far. It seems like when you lean back, you fade out as well.
When I fade back, okay. I'm so sorry about that.
That's okay.
My last point was just
better.
focusing around erectile dysfunction. That's a lot of ways that we see men and get in the office when they actually come to the doctor, when that's having a significant impact on their sex life. I believe Doc mentioned earlier with the different types of medication, and that's true. I've had many patients that have come that we've treated for high blood pressure. They get erectile dysfunction, they're not coming back. And the next time you see them, they need dialysis. And that has happened to me several times, with young guys. So it's always important to explain to them, like Doc said, if you develop any problems with your erections or libido, we can always change the meds. But overall, as Dr. Metcalf mentioned, lifestyle modification, exercise, changing your diet, and those are the things, and building your relationship with your primary care physician, introducing exercise, walking daily into your lifestyle can become it's critical. It's critical in saving lives. So that's what we try to do, what we try to emphasize.
Awesome. Thank you so much. Wow. Dr. Geoff, hopefully you got a couple minutes to share your insights. Thank you, Dr. Courtney, for that. I think everything we've heard so far has just been phenomenal. And I'm sure there's somebody who got something out of tonight's show. But Dr. Geoff, you've been here before. You've talked about COVID. You've talked about and stressed the need for the vaccination. I saw something recently that you had suggested in terms of now that winter is coming, there's 3 types of vitamins that we need to have in our arsenal. Can you shed some light on that? And then, whatever else you wanted to, discuss. But I quickly want people to hear about these because I don't think they have them in their medicine cabinet today.
Sure, great. But let me give everyone the full story. The full story is that while we have COVID, keep in mind, we have 4 other viruses which are common during this time of year. We have the regular rhinoviruses, which causes flu-like symptoms, cough, runny nose, which is responsible for about 60% of all colds. Then we've got the influenza virus, which is the common flu. Then you've got the coronaviruses, the non-SARS-CoV-2 viruses, the ones that have been around for like years. Those cause the colds too, as well as RSV. That's the respiratory syncytial virus. Usually see those in kids, but we see them in adults now as well. Here's my point. Many of them have the exact same symptoms: runny nose, cough, body aches. There is no way to tell the difference between that and SARS-CoV-2. Hence, if you develop those symptoms, it's very important for you to go get tested. Parents, write this down. This is what you want to ask the doctor for. You want to ask the doctor for a COVID test, a flu test, and an RSV test. The reason why you want to get tested is because for the flu and for the COVID, depending on when you come in, there's medicine they can give them to. There's medicine that we can give you. Now, the 3 vitamins that, if I were your primary care doctor, these are the 3 vitamins during this time of the season that I would highly recommend taking. Or let me frame it this way. This is what we take within our family. Vitamin D is absolutely key. Zinc, it's key because it slows viral replication. So, meaning if you get infected, it keeps the virus from replicating as fast. And then finally, regular one. I highly recommend one of your immune complexes. One of those complexes one of those complexes that has elderberry, echinacea, one of those immune complexes. Those are all a slew of vitamins that I would highly recommend this time of the year. But nothing we say on this program should be taken as medical advice. This is just for information purposes only. You should definitely talk to your primary care doctor. Did I hit those points, Miss Campbell?
You did. I also saw something about vitamin K and magnesium and something else.
Yeah, vitamin K, magnesium, they all play a role. The ones I comment on were really about this time of the year, but vitamin K, actually taken with vitamin D, it works best as a combination. And then magnesium, but you got to be careful. You got to make sure that your magnesium's low in the first place. And if you eat a regular diet and you're not an alcoholic, it's very unlikely that your magnesium is low.
Okay. Now somebody asked just real quick about vitamin C.
Well, I think that most of the doctors are here. We're all told that when you get sick, you take your orange juice, and it's going to make you feel. Let me say this: it's not going to hurt you. It's water soluble. As soon as you urinate, you're going to excrete it out. So if vitamin C makes you feel good, then continue to take your vitamin C, knowing that there's not one study that shows that as it relates to colds, it helps, but it definitely helps make you feel better. And so I've got to admit, when I get a cold, I grab my orange juice too. It just makes me feel better.
Yeah, that's true. That's true.
You can mix it. You can elderberry and orange juice.
I couldn't hear you, Doc.
Elderberry and the echinacea with the orange juice.
Absolutely. In fact, you can turn it into a little smoothie.
Oh boy, I have a whole cabinet full of different vitamins and whatnot. But no, that's good stuff. What about chicken soup? It seems like that always works too. I don't know, but we always got chicken soup to go with it. Is there something in the chicken soup?
Well, hold on. So you should have mentioned chicken soup. Here's why, because we just talked about high blood pressure. One of the leading causes of high blood pressure is too much salt. You take too much salt, increases your blood pressure. Next thing you know, you're seeing one of these doctors. So that chicken soup bit, there's some wise tales we should just let go. Chicken soup doesn't help one bit. I'm going to tell you, it doesn't help one bit, but raise your blood pressure, we can get into the intracellular volume. I would kind of let the chicken soup go.
Okay.
I mean, any doctors here, if you see it differently, but given this is a medical show, I can't just endorse the salty chicken soup.
I have to agree.
But I would like to pivot back.
Okay, go right ahead.
Mental health, I think, is key because there are a lot of brothers out there listening, and they're looking to us for some insight to that. And let me just say this, and everyone here practices this in different places, so we may have different insights. But I can tell you this. I think the one brother said it earlier, Dr. Idris, the twin. He said, we're often taught we gotta be macho man and all that kind of stuff. I don't teach that to my son. And I don't let anybody tell my son be a man because he's a little 15-year-old boy and he's not a man yet. I want him to feel comfortable and saying, hey, daddy, I'm not feeling right about something. Or being okay saying, hey, I'm feeling anxious. Because as men, we are socialized. So my point is, grown men, if you're feeling anxious, if you're feeling down, talk to somebody. It just simply means you are normal, especially during this crisis phase we are in. We've been in this thing for 24 months. And I will tell you this, anyone who tells you they feel absolutely normal and absolutely fine and have the whole time, they're lying. They're lying. We've all have experienced something at some point, maybe up here, maybe down here, but COVID has changed us. And I want people to feel comfortable saying, hey, I'm feeling a little down. I want to talk to somebody. And so go talk to a friend, a pastor, someone who you can trust, because there's no need to keep that inside of you. And if you're feeling down, I can tell you a place that's open 24 hours a day, 7 days a week, that will see you if you go in and say, hey, I'm feeling down. I need to talk to somebody, or maybe feeling a little suicidal. You can go to any ER across the country. The moment you say I'm feeling suicidal, they will make sure you have somebody to talk to.
Now that's good information. I don't think people knew that.
Now, hold on.
No,
If you say that now,
now you're gonna have a flood of people in your ER, Dr. Geoff.
well, there's one of the caveat. That's why all the doctors are kind of saying laughing. They're laughing because they're saying Geoff did not say it all. Once you say that, well, you won't be able to go home until they clear you.
Until you're clear.
Yes, until you're clear. But at least you will be safe.
Well, that's definitely good to know. I think, wow. Just in general, I think we've learned a lot. Even me as a woman has learned a lot about my own health and things that I can do to improve my own health. I hope the women that are listening on the show got something out of this. We got a couple of questions. Before we go to the questions, did every doctor get a chance to have their say?
I believe so.
Think so? Okay. Well, it's only a couple of questions. Can extreme back pain cause high blood pressure?
Pain can cause blood pressure. It does. People that have really bad chronic pain, people that have poor sleep. Some of my patients that are most difficult to treat are some that really have obstructive sleep apnea. Those are some of the most challenging patients that I treat with blood pressure. But pain, anxiety definitely can raise your blood pressure.
Absolutely, because pain increases what we call the sympathetic response, and that's that norepinephrine, that's that flight or flight syndrome we have. So just with those chemicals circulating in your bloodstream can increase your blood pressure. So, and anytime someone comes into your office in pain, typically their blood pressure is going to be elevated higher than normal. And therefore, like when we have patients, even when we just say, even if someone has just overexerted themselves, your blood pressure is going to be high. So when you come into a doctor's office now, you need to be sitting down for at least 10 to 15 minutes, and you need your blood pressure checked with your arm at your level of your heart. And you need to have to be resting for about 15 minutes. But any increased activity, of course, caffeine and definitely pain can increase that sympathetic response. That's going to increase your blood pressure. No question.
Would y'all recommend that people invest in just having a blood pressure cuff at their house?
Absolutely.
Yeah, that's what I was thinking. I think it's like, I mean, you can get it at CVS, Walgreens, Walmart, Target,
Yeah.
right?
Yeah.
Yeah, I think it's important
Well,
because
hold on. So invest in it, but make sure you check it the same time every day, and don't spend all day checking it, because otherwise it's going to throw you off, and you're going to get very, very anxious. So if you check it the same time every day, and if you want, you can keep a log, but I promise you that your blood pressure goes up and down all day.
What's interesting too is Medicare has a program called remote patient monitoring, and they give our patients a free glucometer for feb diabetes, a scale, and a blood pressure monitor, and it's free to the patient. And then as they get up every day and they take their measurements, that's sent to a file, and we're actually, as physicians, I get notified whenever it's above certain levels. So for our Medicare patients, with any of their primary care physicians, they can ask them about remote patient monitoring, and that is free to the patient. It measures, again, blood pressure, blood sugar, and their weight, their scale, with a scale.
oh, that's good info.
Mm-hmm.
Someone also said that if you have like a flexible spending account or a health spending account with your employer, you can buy it. They'll pay for it if it's, I guess it says HSA, FSA pays for a blood pressure cuff. So I guess that's something else to keep in mind. There is a counselor on said that her name is Barbara Biggs. She says, I'm available for consultations, Tranquility Christian Counseling in Southfield, Michigan. So for those that are in Michigan, and you probably can see this in the chat on Facebook as well, she has her address, zip code, it looks like, and phone number on here. But there are services out there. She's just putting it out there in case somebody in the area, the Detroit area, may want to have some Christian counseling. She's available and taking clients. Wow.
And you can put that in the chat, can't you, Michelle, if you like? Can you
Yes,
post that
it
for
is
people
in
that are
the
watching?
it's in the chat. Yeah, it should be in the Facebook chat.
Okay.
Um, yes, and that's another point. I know all the doctors on here. I talked about some of the shows that you have, books. If you guys have anything that you personally want people to point to, if you have your own pages or programs or anything that you want to share, I'm going to just go round robin and get just you can spit it out, or you can put we can definitely have it put in the chat afterwards. But Dr. Scott, I know you're already, you're on television right now on Married to Medicine. I know that you're doing things with HLN and different shows and podcasts and whatnot. Anything else you want to share with the audience here tonight?
I guess my well, as far as social goes, I think I'm Dr. Scott Metcalf on all platforms that I'm on, and then under our medical would be Chastain Integrative Medicine. And then to add on with the patients with the health spending accounts, they also will a lot of patients can use those for alternative medicine as well. So they can use those for PRP injections when they have chronic pain. They can use them for aesthetics as well, which we offer at our practice. So, but I wanted to top one thing I want to touch on was that we have, and not in addition to our COVID-19 vaccines, we also need to make our colleagues aware that, or our Black males aware that, annual flu shot is recommended. Uh, you once you reach a certain age, you can get your or what conditions you have, you can get a pneumonia shot, a pneumonia vaccination as well.
Mm.
Your tetanus shot that comes every 10 years, and for our males over 50, it would behoove you to get your zoster vaccination. That's your shingles shot, and that's often overlooked in males and females. But we all have that chickenpox virus dormant in us, from when we were kids, when our parents had us go to the chickenpox party and get chickenpox. So that virus is living dormant in our system, and that virus can pop out at any time, and there's a high rate of it popping out once you turn 50. So, once you reach that age of 50, go get your shingles vaccination.
All right, good info. Dr. J, let's go to you.
Well, you can see us periodically on Black News Channel nationally, Fox 32 Chicago locally, ABC 7 Chicago locally, and on all of our platforms, social media platforms, it's the same as the Twin Doctors. And also our book, Everything You Ever Wanted to Know About Pregnancy, but We're Too Afraid to Ask, probably the longest title ever for a book, but you can get that on Amazon as well. That's about it.
All right, Dr. I, you want to add to that?
Well, kind of what he said. I'll piggyback off of him. I'm twin B, so I'm coming second. That's all right.
All right, awesome. Let's go to Dr. Courtney.
Well, I'm at Shelton Hospital Group, also Body Rejuvenation as well, all on Facebook and IG.
Great. Can you say that again, but a little closer?
Body Rejuvenation and Shelton Hospitalist Group.
Okay, thank you. Thank you. And Dr. Geoff.
Hey, Dr. Joffrey here. You can catch me on the Black News Network at least once a week. You also see me. I do a regular Medical Mondays on WAOK, as well as please join me on Instagram at Dr. Joffrey, Geoffrey MPH, Mary Paul Harry. And please be sure to follow me as well on my YouTube channel, which is at Dr. Joffrey MPH. And Michelle, thank you for having me. My fellow guest, great job. I'm honored to be here. Great show, Michelle.
Thank you, thank you, thank you. And wow, I've been having wonderful guests all year long, and these shows always surprise me. They always surprise me. I am so pleased to have each and every one of you on here tonight. Thank you for staying over a couple minutes. I think we got through all the questions. And let me just say my thank yous here. You know, I don't want to miss anybody, so I do write these things down. All right. So I would like to give a special thank you to our panel here today, this evening, Dr. Scott, Dr. J, Dr. I, Dr. Courtney, and Dr. Geoff. I believe this information we received today is going to change someone's life. I think you're going to save someone's life. They're going to get out there, go see their doctors, go talk to a counselor, do all the things that they need to do to stay healthy because we got to be around. We got to be around. People our age are dying, you know, left and right. It's like every month I'm hearing about someone passing away, and that's scary. It's not just from COVID, okay? It's not just COVID anymore. It's a lot of stuff out there. So please be safe, everyone out there. And of course, I like to thank everyone in Smack Nation. You always show up and show out. If you didn't catch this show live, catch it on the replay, either on the YouTube channel, Smack Productions, or on the Facebook page. And if any of the doctors don't have anything else to say, we can close out for the evening.
All right. Well, thank you so much. It was a pleasure, everybody.
Thank
All
you.
right. Thank you, everyone.
Thank you
Good
very
night.
much.
Yes. All right. Take care.
Bye bye.